Dr. Schu here, your Jacksonville area chiropractor, with one of our great patients, Ryan. Ryan is a personal trainer with the world's largest outdoor fitness company, which is
Camp Gladiator.
Yeah, so go check it out. If you're in the Jacksonville area, make sure you check out Ryan. He is awesome, knows what he's doing, really gets after it, and has camps all throughout week, right?
Mm-hmm.
Evenings, mornings. So great location for him in Jacksonville. Make sure you go check him out. We'll put his information up here for you. But what we're going to do with Ryan today is we've been focusing on his hips. Right-sided psoas, really tight, really tender. A lot of stuff with extension, walking, running, really been giving him a lot of troubles. Squatting, not so much, but after he's been squatting early on, was feeling really sore for a few days. So after assessing everything, we found a lot of hip restrictions with him, actually on the right and left side, a lot on the left, but we also did some x-rays and we actually found that he has some femoral hip impingements due to some femoral head anomalies. They're not as round as they should be, and kind of hits that joint in the pelvis. So been living with that his entire life, but with working out, doing all the different activities, just kind of has popped up lately, causing some pain. So what we've been doing is a lot of soft tissue work with him, adjusting, making sure those hips are functioning right, and also the ankles too. So let's get started. Sound good?
Mm-hmm.
Let's do it. So with Ryan, since he's been having a lot of hip impingement issues, side posture really hasn't been the most comfortable for him. So what we've been doing is a lot of drop work in this pelvic region, which allows him to lay face down on the table, be in a more comfortable position, but allowing us to get some motion in those sacroiliac joints. So what I'm gonna do is just 3 times straight down on each side, okay?
Okay.
Feel all right?
Mm-hmm.
So what we're going to do is we're going to get in here, do a little bit of manual release right on that psoas muscle, take him through some ranges of motion. Then we're going to go look at some hip mobility on that left side as well. So just go ahead, relax, breathe naturally. Don't try to hold your breath here. I'm going to dig in, probably going to be a little tender, okay? Tender at all today. What I'm doing is just compressing that psoas muscle right down and just trying to get it moving a little bit, shearing it back and forth. And now we're going to take him through some hip ranges of motion. Okay with that?
Mm-hmm.
Let's go ahead and check hip mobility here. Feel okay with that today?
Mm-hmm.
It's a little bit better than what it's been.
It worked out this fine.
Yeah. Good. So what we noticed on his exam was left side internal rotation of the hip was really, really bad. We can go inside pretty good here, but I get him to end range pretty quick. And what really cued me into taking some x-rays with him, especially with his hips were, he could not internally rotate his hips actively, but when I tried to do it passively, I was getting blocks early on. So really knew something in there was going on with the hips. Didn't really know quite what it was, but when we did the x-rays, we found that anomaly and found some impingement issues in there. So though we're not going to get crazy amounts of end range here, those muscles have adapted over time. So we're just trying to get as much as possible here. So again, you're pushing in, and I'm going to pull out when we relax, okay? So go ahead, push in. Good, relax. Push in. There we go, keep going, keep going. Good, and relax. So what he's doing is he's actually, go ahead, push. He's pushing in with his heel, which is externally rotating his hip while I'm resisting. Go ahead, relax. And as he relaxes, allows us to get a little bit more internal rotation with that hip. So when assessing this overhead squat during our assessment, we also noticed a severe lack of dorsiflexion in this left foot, causing a big shift at the bottom of the squat. So we've been doing some ankle work as well. What I'm doing right now is wrapping this up to adjust it, because sometimes he doesn't really like to relax his ankle when I'm trying to adjust it. So this gives it a little bit support, so his body thinks that his ankle's stable, allows it to relax a little bit, and I can really get in there and get this ankle joint moving. Along with the hip, we're also looking at this back a little bit. We're really really tight on this right side. So I'm going to actually have him do some active exercise with rotation to focus on this left side, but we're also going to apply some cupping to really stimulate that area too. So go ahead, hand behind your back. Is that too much tension on that cup?
It's fine.
Good? Okay. So just coming up, we're just going to do it a few times. So as he's doing this, I'm just going right through that set of muscles in his low back, trying to fire those up with the cupping while he's doing this active range of motion. Feel okay with that?
Mm-hmm.
Good. It really doesn't take him long to get flared up in this area, so don't apply the cups for too long. Okay. Relax just for a sec. Let me wipe that up. And now what I'm going to have him do is just another set, but we're going to do it without the cupping. So go ahead, go back through. Really try to get that elbow to the ceiling and open up this side. Okay. Good. All the way down and all the way up. Sit back, we're rounding this back a little bit. There we go. Try to keep that back straight as possible. Good, one more. Awesome. Good. All right, so that's all we're gonna do with Ryan today. We focused on the hip, went to his ankle, the low back. As you can see, we don't really just try to chase pain. We actually look at what's causing the pain, the underlying factors, and we try to look at movement patterns, things like that, and correct those underlying causes of his pain. So after all that, how you feel today?
So far, so good.
Yeah, so we've been doing a couple treatments for a couple weeks now, seeing a lot of good improvement, been working out lately, squatting, things like that, really haven't had any flare-ups. So looking forward to really digging more into it, getting creating a lot more hip range of motion, and really see how he responds over the next couple visits. So appreciate it, Ryan. Thanks for coming in. Again, remember to check him out at Camp Gladiator here in Jacksonville. And thank you guys again for watching my videos. Make sure you check out my Facebook and Instagram, and we'll talk to you soon. Have a good one.